Every global effort begins by bringing the right people into the same room. For us, that beginning was the International Congress on Pathogens at the Human-Animal Interface, or ICOFA. ICOFA convenes scientists, clinicians, veterinarians, and public health professionals around a shared concern: the growing threats emerging where human and animal health intersect. ICOFA created a space for cross-disciplinary dialogue. Through scientific exchange and global partnerships, ICOFA elevated the importance of collaboration at the human-animal interface. It became a platform that sparked research partnerships, strengthening networks, and amplifying the urgency of integrated approaches to disease surveillance, prevention, and response. Through convenings and knowledge sharing, ICOFA reinforced a critical truth: health security depends on coordinated action. But as conversations deepened, the vision expanded. It became clear that protecting global health required more than periodic convenings. It required sustained collaboration. From that realization emerged a new chapter. Building on the scientific foundation and global relationships cultivated through ICOFA, we evolved toward a more action-oriented platform, one that would extend beyond congresses and translate dialogue into coordinated solutions. That evolution gave rise to the One Health Global Alliance. OHGA carries forward the spirit of ICOFA, the commitment to science, the power of partnerships, and the urgency of integrated action. From convening experts to building a global alliance, this is the next chapter of a journey that began at the human-animal interface and now advances One Health solutions worldwide.
So One Health is not a new concept. It goes back to the times of Hippocrates and even Aristotle. But our understanding of One Health was really reconceptualized at the beginning of the 21st century. We had new drivers and new factors that converged together, from growing populations and people and animals, travel, trade, problems with our environment, our ecosystems, adaptations of organisms. And this created a whole new environment for new emerging infectious diseases, re-emerging infectious diseases. Most of them were zoonotic in nature. So the whole idea of One Health then came forward into a new era. So we've made significant progress in the last couple decades, but certainly we lack in the wide acceptance and the effective implementation of One Health still. Our world now looks at antimicrobial resistance, new zoonoses that can cause pandemics, food safety, food security, new vector-borne diseases, and new natural disasters because of climate change. So in order to address these, we need to fill some challenges and some gaps. And those would be the lack of resources to One Health and One Health research, the collaboration and coordination across disciplines and organizations, and certainly the need for systems and critical thinking. And One Health competent workforce needs to be expanded as we move forward during this critical time.
The challenges we face today aren't limited to a single country or nation. Pandemics, food insecurity, disease. These are issues across the world and therefore also require global solutions led by globally competent teams. But not everyone has the opportunity to develop these much-needed competencies and skills. We need more young people to have the opportunity to learn from peers and mentors from around the world. We need more knowledge exchange between people of other backgrounds, cultures, nationalities, and disciplines. Today's problem solvers, and those of the future, need more opportunities to do joint research, work together in labs, do field research, develop the networks and capabilities to contribute meaningfully to the global workforce, and help us address the global health threats that plague the world.
One is that we need to strengthen local research and development capacity. We need to empower local researchers, practitioners, and policymakers to lead and sustain health research and innovation initiatives by providing sustainable training and fostering mentorship, especially as we partner between the more developed world and the less developed world in the South. Secondly, we need to act in a way that we can decolonize global health and practice. As a One Health Global Alliance, we wish to lead in shifting influence of research and development on public health to low and middle income country settings, so that researchers here can lead, do practice of science and especially innovation through equitable two-way partnerships for developing context-specific and appropriate solutions for public health.
We know that partnerships that are global can be very positive for the overall mission of the institution. But what has been lacking has been thinking in terms specifically of what each party expects to get from that partnership, as well as what does each party to the partnership expect to contribute. And these things need to be clearly defined in order for a partnership to be sustainable. Given what is happening in the world today, with the need for expertise in the field of global health, there is no better organization than the One Health Global Alliance to provide top-notch experts in the field of global health.
Every successful initiative is built on strong person-to-person collaboration, people trusting people. OHGA's regional office exists precisely for that, to embed our network with local context, sustaining long-term relationships, bridging sectors across academia, public, private, institutions, policymakers, and disciplines that speak to each other. Communication has been always a problem to effectively tackle the real problems. We now have the chance to combine the power of the modern communication skills to our strong and robust network. So I think that OHGA pushes boundaries, connects the right people to the right problems, because people are the real catalysts.
Our mission is simple and yet bold: to turn collaboration into impact. One Health Global Alliance is an on-demand global catalyst that brings together experts across animal, human, and environmental systems to tackle the world's most pressing health challenges. We help turn ideas into action through cooperation, strategic consultation, and capacity building. With a network spanning 80+ countries, our goal is to help design and deliver practical and yet scalable solutions that are rooted in local realities. With an ever-evolving global landscape shaped by emerging diseases, climate change, shifting geopolitics, and rapid innovation, staying nimble isn't optional. It's essential. OHGA is built to adapt, to convene quickly and mobilize experts when and where it's needed most. Through our collaborative platform, our goal is to turn One Health from a concept into a movement, empowering professionals, strengthening systems, and building a healthier, more connected world. We invite you to join us, to collaborate, to innovate, and help shape the future of global health together.